Bev, tell us what you're doing.
I am dispensing your Prevora now for you behind me in two different wells to keep track of them. The first stage will appear a little bit brownish in color, but you won't see that on the teeth. And then the final one is a milky color. So I have two different colored tips here for application so they don't get confused as well. Okay, so I'm going to lay you back a little bit further, Jimmy, so I can see you here. Okay, so we're going to start on the bottom left-hand side here. These are just cotton rolls. They're going to go one in your cheek and then the other by your tongue here, just to keep it dry in there. You dry it off. Perfect. Thank you for staying open. First stage on. So we apply it up from the gum line in between all the teeth. You want to dab it in between the teeth so we can get into lots of spaces. Perfect. A little bit of air in there. You may feel a little bitter taste that goes away very quickly. I will let you rinse out at the end with some water. Second stage now going on. Again, the same thing. We're going to apply it along the gum line up the tooth and dab it in between all the tooth surfaces. Okay. And then we'll air dry that again. Good. And we'll move on to the next area of your mouth. People who have dry mouth will have that from people who have been going through any cancer therapy because their saliva glands are affected. Those people, the bacteria and the pH level in their mouth is really out of balance, and they are the first to get a lot of root decay happening inside their mouth. The saliva that we produce naturally is what keeps, our pH balance intact and helps us to, make sure that we don't get decay. So those people, so if you know anybody, going through cancer therapy, those would be excellent candidates. This product is widely used at Sunnybrook, Toronto General. All the cancer specialists in Toronto use this for all their patients before starting treatment.
Why?
Because they're such at risk. They have lower immune systems based on what they're going through, and we don't want this bacteria. So bacteria is on the outside. When we have bleeding gums, that bacteria enters through into the bloodstream and through our saliva and travels throughout our body systems. That's why it can affect your heart, your lungs, any of your major organs inside your body. So we really want to keep everything as healthy as we can. This is a game changer, as I said, to keeping health inside our body, our mouth. I tell people this and they kind of shake their head at me. There's over 300 different strands of bacteria in your mouth alone. 300. That's a lot of bacteria to fight off. Okay, we're almost finished the bottom, Jimmy. You're an excellent patient. Here we go. We're doing the top. Then we're going to go onward to the top. Again, same process repeated over and over again. You will feel like your teeth have gum stuck to them all. That's the feeling you're going to get at the end of all this. Just going to air dry that last one. 1 second. Perfect.
And Bev, I know the hygienists who are watching are squirming in their chair because I keep talking while you're doing this. But I want to ask, if I'm somebody who hasn't been to a dentist in a few years and I'm worried about what's going on or I'm concerned, what kind of difference could a Prevora treatment and an assessment or cleaning from Gift from the Heart make as a first step? Just talk to me about the difference between not being to a dentist in a while and what Prevora could do as a beginning point on the journey to good oral health care.
Sure, I'd love to talk to you about that. So, first step is the biggest step of all to me, and that's picking up the phone or sending Gift from the Heart an email to say, I'm interested, tell me more. Once we get to that stage, that is critical, right? Then we can share with them, what we're able to provide for them. And again, just having someone look at your mouth to, take the concerns away. Am I having any problems? Do you see anything in there? Should I be concerned? that is, a big part of it. That's why we worry so much, is because we really don't know. We need a professional to take a look inside our mouth. So having that, assessment done, another word for assessment is like a look and see, right? We're going to take a look and see inside your mouth, and let's talk about what's going on. Let's talk about your concerns. What is it that you're worried about? Do you have some pain or discomfort? Do you have bleeding gums? What are your concerns? And Get from the Heart will look at those and discuss them with them. Sometimes it's just nice to have someone to talk to, right? And then, the same thing with the oral cancer screenings. We want to make sure that, that there isn't anything alarming happening in there. That, if it is, we can, use our resources to find you someplace to go. That's key. We want to make sure that you're getting the treatment that you require.
Okay.
And then the last thing about it is, if there is some bacteria in there that is out of whack, as I call it, or just, too much of one thing over the other, then we want to, use again products that we have on hand. This Prevora is incredibly, amazing what it can do. It's critical. This will help to lower the bacteria. So possibly buying you some time before you have to make a major decision about what's going on inside your mouth. Two, remember that the fillings that we use now, the material that we use to put fillings in place, is white or tooth colored. We can't put those in if the tissue is, inflamed, bleeding. We don't get the same results from putting it in that way. So let's get the mouth as healthy as we can first before we have to do anything else. Even if that is an extraction or removing a tooth that, has already outlived itself, in your mouth, then having the gum tissue in the mouth as healthy as we can will help with the healing process as well. So again, in every aspect, it's really important that we get the mouth as healthy as we can, because if your mouth is healthy, then your body, you are healthier because of that. Your mouth is the window to the rest of your body. So we really want to ensure that we start with the mouth, get that as healthy as we can, because you'll feel better. People who have had this treatment put on will reportedly come back and say, "Oh my goodness, I'm feeling so much better. What did you use?" And that's just because we are arresting the bad decay in there, allowing the good bacteria to start to, flourish inside your mouth. And with that, then the rest of your body can work on what it needs to do. So we're in the last stage now, Jimmy. We're going across the front teeth now. It's our last part to do. And then we'll be done with your Prevora. It takes about 15 to 20 minutes, depending on the patient. You're an excellent patient. Even though you think you talk a lot, you're doing really, really well here. So it's all good. So here we go on the top ones again. Each of those canisters that I opened up are individual for the patient. We don't cross-contaminate. We don't use what's left over for someone else. It has a good shelf life on it. So we will continue to use this product that's left in the bottle for you, particularly as you keep coming in week after week. And as you said, I mean, you are at a stage where you are trying to come back from some past, problems with your teeth. So some people less often coming in. You, however, once a week for the next 3 weeks. Continue to keep fighting this bacteria off is really, really important. We really want to really help you out as much as we can with this bacterial lateral. You have some spots. Gum tissue, as you said, isn't as firmly as attached. So we want to, you can see, especially in the front here, I'm really introducing it, right at the gum line between the teeth, around those gum tissues as much as I can with that chlorhexidine product. I'm going to air dry it again. Perfect. Last stage going on. And even though they're all colorful and thing, at the very end, when it's all said and done, you won't be able to see that anything is on your teeth. And there, a lot of people ask me, Jimmy, too, like, will this affect, like, if you have crowns or bridges or an implant in your mouth or anything like that? Will this help? Will this destroy it in any way, affect it? Or no, not at all. This is a very, very safe product. In all the years that it's been used, there's been no adverse reactions from anybody. So feeling very confident. We at Gift from the Heart have known about this product for years now. So to let it ride out its course with other people trying it first before ourselves. And now we feel very confident to introduce it to the residents of the Bay of Quinte.
Wonderful.
So let me sit you back up now. Another happy customer. So let me just review again your take-home instructions for you, Jimmy. I'll take that from you. So with it, I am providing you this take-home instruction for yourself, which tells us, that you just had that coating put on your teeth, not to brush for 24 hours, to not floss for 3 days, which is sometimes a real win for a lot of people.
Yes.
Avoid some hard foods, like don't bite into an apple, carrot,
Yeah.
things like that right away, because it'll just break apart on your teeth. And avoid the acidic drinks, so cola, sport drinks, things like that. And I would say, like, don't have a tea or a coffee right away, because
Nothing
again,
extremely hot.
right?
Yes.
Because it'll sort of like melt it away.
Yes.
And then that's my battery. Let's cut that out. And then we will be sending you home with a Crest Oral-B toothbrush,
And why are you sending me home with a new toothbrush?
because we do not want there'll be old bacteria
On the old toothbrush.
That's right.
Mm.
So some people can get rid of that by dipping it in hydrogen peroxide, but we want to start with fresh. Your mouth is now fresh with less bacteria after those 3 days or 24 hours start to brush with. We want to make sure that we're not reintroducing
Right.
the harmful bacteria
Right.
in your mouth. Give
Wonderful.
it every fighting chance that we can provide for it.
Absolutely. And if you don't mind, do you mind having a seat, Bev? I'd like to tell you something and then ask a question.
Yes.
And I just want to share something from like my perspective. So I know for me, when I was going through not going to the dentist for a number of years, the idea of my situation becoming worse was happening. But it was like I was stuck. And it wasn't until I was forced to take action that I did. But what I would want to share or convey to anybody who might hear this or become aware of this, that no matter what the starting point is, where you're at, if you are curious about where you stand, how bad is it? Because it might not be as bad as you think. It wasn't as bad as I thought it was.
Right.
It wasn't great, but it was. I could have taken steps earlier, and so I share that because, in my mind, Prevora is a preventative action that anybody can take if they're willing to try, no matter where their starting point is. And if they give it a shot, that after 3 to 6 months, just coming back here to say hello and have another look in, as you refer to it, um, I would imagine and be very confident to say that there would be an improvement in just that action. And this is the starting point, and we want to let everybody know that. And it's word of mouth, grassroots. It's going to start with one today, me. And we're going to have Prevora Day here at Loyalist on June 25th. We're then going to open up our doors in Brighton on June 26th, the next day. We're working to get this offered in Prince Edward County the beginning of July. We've already got Trenton Memorial Hospital on the 16th of July. And so we're really excited to be able to take these milestone steps for Gift from the Heart and the Bay of Quinte community. And I just wanted to thank you so much for this time, because it was really nice. Thank you.
And I want to add too is that we were talking about first steps and not really, knowing what's happening in your mouth. And even if we only took that initial look and provided you with some dialogue about where else you could go, that really eases the stress on the individual, because, right now we know that a lot of the phone calls are not answered by live people. We don't get that one-to-one. This, as you can see, is one-to-one. There's no one else listening in. You don't have to be afraid that your information is going to go anywhere else. We just want to have a conversation with you to help to ease any misgivings that you might have. If we can even teach you just about oral hygiene care, provide you with a toothbrush or something to take home as the first step until you feel comfortable. We don't have to do all this in one appointment. We can do baby steps until you feel comfortable coming in and then exploring the next possibility. So, as I said, the first step is making that initial phone call, coming to one of these free days that Jimmy talked about. Just make the initial step, even if you just want to come and meet us. That's great too. So we'll work along at your level, not on what the industry level is. So I just want to share that with people because at Gift from the Heart, we are a nonprofit charity that's here for the people. Okay, we're not here to make money or to do anything else. We're here to fill the gap in the systems right now that exist, and we really want to help you out.